We are performing a study, the BioResort randomized clinical trial in 4 Dutch centers, PCI centers, in more than 3,500 patients. The data have been reported at TCT last year and published in The Lancet. And when we designed the study, we had the idea to perform a prospective observational sub-study at Zorgcentrum Twente, the center that organizes this trial and is the main enrolling center. And we felt that it was a good idea to invite the patients who were not known to have diabetes to undergo an oral glucose tolerance test and assessment of HbA1c in order to look for the prevalence of silent diabetics and pre-diabetics, and then also look at the outcome of this patient population. We saw that using the oral glucose tolerance test for the assessment, 7% of the patients had silent diabetes and a total of 20% had an abnormal glucose metabolism. When we used an alternative approach, HbA1c and fasting glucose, we found that 25% of our PCI all-comers had abnormal glucose metabolism. The silent diabetics reached in 13.1% composite endpoint target vessel failure, consisting of cardiac death, target vessel related MI, or target vessel revascularization. The pre-diabetic patients reached that in 6.1% and the normal glycemic in only 2.8%, so really low event rate for the normal glycemic patients, and that difference was statistically highly significant. When we look deeper into the data, we see that in particular the target vessel MI differed, and then the early target vessel MI, the peri-procedural MI. So we gain really very important information about the prevalence of the problem, which is quite high, and also what is the driving force of this increase in events. This is important information which we need in order to perform power calculations for potential future studies. We need to be aware of the problem, and we need to have this data in order to test novel approaches aiming at an improved treatment of our patients with abnormal glucose metabolism.